Asthma, am I right? It's one of those conditions that sounds almost whimsical, like something out of a children's book. But trust me, it's anything but. Sounds like something you'd whisper to a dog during a poker game. "Hey Fido, I've got asthma." The dog would probably just tilt its head and give you that confused look. "Asthma, I've got a flush." But instead of winning the pot, you're just trying to catch your breath. But sadly, my friends, it's not that glamorous. It's more like being dealt a bad hand over and over again. Asthma is a chronic respiratory condition. It's like your lungs decided to throw a tantrum every now and then. It's like having a tiny bouncer in your lungs. This bouncer is supposed to keep things in order, but sometimes it just goes on a power trip. This bouncer, however, has some questionable policies about letting air in and out. One minute, you're breathing fine, and the next, it's like trying to get into an exclusive club with a fake ID. Think of your airways as those inflatable tube men you see at car dealerships. They're all over the place, flailing around, flimsy and prone to sudden deflation. One moment they're up, the next, they're down. That's what happens during an asthma attack. Your airways constrict, making it feel like you're breathing through a straw. Imagine trying to suck a thick milkshake through a tiny straw. Frustrating, right? A very small, very annoying straw. It's like your lungs are playing a cruel joke on you. And just when you think it can't get worse, it does. But here's the thing. Now, before you start panicking and picturing a life confined to an oxygen tank, though hey, those things are kinda cyberpunk chic, know this: asthma is manageable. With the right treatment and lifestyle changes, you can lead a pretty normal life. You just gotta know how to play the game. It's all about strategy, knowing your triggers, and having a plan in place. So buckle up, Buttercup, because we're about to dive deep into the wonderful world of wheezing. It's a wild ride, but with a little humor and a lot of knowledge, you'll be just fine. And trust me, by the end of this, you'll be laughing all the way to well, maybe not all the way to the hospital, but you'll definitely have a better understanding and maybe even a smile on your face. But you get the idea. Asthma might be a part of your life, but it doesn't have to control it. Let's take a hilarious look at how to manage it and live your best life. All right, let's talk symptoms, shall we? Asthma can be a sneaky condition, often catching people off guard. But if you know what to look for, you can manage it much better. Because knowing is half the battle. The more you understand about asthma, the better equipped you'll be to handle it. The other half is probably medication, but mostly knowing. Medication helps, but awareness and preparedness are key. Asthma symptoms are like that friend who always brings chips to the party, but then eats all of them. They show up uninvited and can be quite disruptive. You know it's coming, but you can't help but be slightly annoyed. It's a constant presence that you have to deal with. First up, we've got the classics: wheezing. This is one of the most recognizable symptoms. That charming whistling sound you make when you breathe. It's like a tiny flute player has taken residence in your lungs. It's like your lungs are trying to learn the flute, badly. And no matter how much they practice, they just can't get it right. Then there's coughing, your body's way of saying, hey, something's not right in the air department. This is your body's alarm system. This cough is persistent and often worse at night, like a nocturnal party animal that just won't quit. It can keep you up, making it hard to get a good night's sleep. Shortness of breath is another crowd pleaser. It can make even simple tasks feel like a marathon. Suddenly, climbing a flight of stairs feels like scaling Mount Everest. Every step becomes a challenge. And finally, chest tightness, like someone's sitting on your chest. This can be one of the most uncomfortable symptoms. Hopefully, it's someone you like, but in reality, it feels more like an unwelcome guest. Now, these symptoms can range from mild to call 911. It's important to know when to seek help. Knowing your triggers and how to manage your asthma is crucial. Identifying what sets off your symptoms can help you avoid them. So let's move on to the next level of this wheezy game, shall we? With the right knowledge and tools, you can take control of your asthma and live a full, active life. Triggers, my friends, are the villains of the asthma story. They're the dust bunnies under the bed, the pollen partying in the air, the pet dander clinging to your favorite sweater. They're lurking, waiting to set off an asthma symphony in your airway. We've got the usual suspects: dust mites, pollen, pet dander, mold. These guys are everywhere, like tiny ninjas of respiratory distress. Then there's smoke, whether it's from cigarettes, that bonfire your neighbor insists on having every weekend, or even incense. Exercise can also be a trigger, which seems unfair, right? You're trying to be healthy and bam! Asthma attack. Cold air, strong emotions, and even some medications can set things off. It's like your lungs are playing a never-ending game of what will make me wheeze today. But fear not, dear reader. There are ways to avoid these triggers. Keep your house clean, invest in a good air purifier, and perhaps consider getting a pet fish instead of a dog. Or a pet rock. They're very low maintenance. Section 4. Inhalers and chill. Managing your asthma like a boss. Living with asthma doesn't have to be a constant struggle. With the right tools and knowledge, you can manage your asthma effectively and live a full, active life. So you've identified your triggers, and you're dodging them like a champ. Whether it's pollen, pet dander, or dust mites, knowing what sets off your asthma is half the battle. By avoiding these triggers, you're already taking a huge step towards better asthma control. But what happens when that pesky asthma sneaks up on you? Despite your best efforts, there will be times when you might experience symptoms. It can be frustrating and even a little scary, but don't worry, you're not alone. That's where medication comes in, specifically those trusty inhalers. Inhalers are a crucial part of asthma management, providing relief when you need it most. Inhalers are like tiny fire extinguishers for your lungs. They deliver medication directly to your airways, calming down the inflammation and opening things up. This quick action can make a world of difference during an asthma attack. They deliver medication directly to your airways, calming down the inflammation and opening things up. This targeted approach ensures that the medication works quickly and effectively, providing you with the relief you need. There are two main types: relievers, which are your go-to for quick relief during an attack. These inhalers work fast to relax the muscles around your airways, making it easier to breathe within minutes. And controllers, which you take daily to keep inflammation at bay. These inhalers help to reduce the swelling and mucus in your airways, preventing asthma symptoms from flaring up in the first place. Now, using an inhaler isn't rocket science, but it does require a little finesse. Proper technique is key to ensuring that the medication reaches your lungs effectively. You gotta make sure you're using the right technique so the medication gets where it needs to go. This means inhaling at the right time and holding your breath for a few seconds to let the medication settle in your lungs. You gotta make sure you're using the right technique so the medication gets where it needs to go. Practice makes perfect, so don't be afraid to ask for help if you're unsure. Ask your doctor to show you the ropes. They can provide you with a demonstration and tips to improve your technique. It's always a good idea to have a healthcare professional guide you, or consult the handy-dandy instructions that come with your medication. These instructions are there to help you, so take the time to read them and understand how to use your inhaler properly. Beyond medication, there are other things you can do to manage your asthma. Breathing exercises, like diaphragmatic breathing, can help strengthen your lungs and improve your control over your breathing. These exercises can be a great addition to your asthma management plan. Breathing exercises, like diaphragmatic breathing, can help strengthen your lungs and improve your control over your breathing. These exercises can help you stay calm and focused during an asthma attack, making it easier to manage your symptoms. Staying active is also important. Regular physical activity can improve your overall lung function and help you maintain a healthy lifestyle. Just remember to take it easy and listen to your body. But make sure you're warming up properly and listening to your body. A good warm-up can help prevent asthma symptoms during exercise, so take the time to prepare your body before you start. And don't forget to cool down after your workout. This can help your body adjust and reduce the risk of post-exercise asthma symptoms. With the right approach, you can stay active and keep your asthma under control. Section 5. Breathe easy, my friend. You got this. Asthma might be a chronic condition, but it doesn't have to rule your life. By understanding your triggers, managing your symptoms, and working closely with your healthcare provider, you can live a full and active life, free from the fear of sudden wheezing fits. Remember, knowledge is power. The more you know about your asthma, the better equipped you'll be to handle whatever it throws your way. So keep learning, keep asking questions, and most importantly, keep breathing easy. You got this.